Hello everyone. In this next video of the function release technique series, we are going to learn the manual therapy skills that are required to perform ischemic compression and function release for the subscapularis muscle. Subscapularis muscle is important to be screened and treated, especially in patients who complain of limitation in the shoulder external rotation and abduction ranges. Subscapularis muscle, as it originates from the scapula and inserts to the lesser tubercle of the humerus joint, is a strong internal rotator of the shoulder joint. And this is again prone for getting tight and shortened. Therefore, it becomes important for a physiotherapist to screen and treat this muscle. Function release technique is one such approach which can help in quickly relaxing and regaining the muscle length of the subscapularis. So let's get started with the practical demonstration for function release technique to this muscle. To perform the technique, patient is going to be in the supine lying position and the therapist is going to stand towards the head end of the treatment table. The side that needs to be treated, the shoulder is going to be taken into about 90 degrees of flexion and the elbow is also going to remain 90-degree flexed. The therapist is going to hold the treatment side arm in such a manner so that the hand cups around the elbow joint while the patient's hand is hooked around the therapist's elbow. And now from here, the far hand of the therapist is going to go from the axillary side to reach for the anterior and lateral border of the scapula. And from here, we are actually overlying our fingers over the subscapularis muscle. Now, to confirm that we are over the right structure, we can ask the patient to perform the internal rotation movement, for which the patient is going to push the hand towards the therapist's elbow and the elbow of the patient is going to be pushed outwards. And while the patient does that, we are going to feel for the contraction in the subscapularis muscle. And now the transverse palpation is going to be carried out to look for the tender points or taut band within this particular muscle. And now once the taut band are found, the therapist is going to deliver the ischemic release to this region for around 90 seconds. Ischemic release can next be combined with the function release, in which the patient is going to remain relaxed and the therapist is going to passively take the shoulder into the internal rotation and external rotation ranges while facilitating the elongation and shortening of the taut band. So this is going to be the function release for the subscapularis muscle. Do try this technique, which is although painful but quite effective in regaining the shoulder external rotation ranges. I sincerely hope that the information shared in this video is going to be helpful for you all. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.